All right, good evening, everyone. Will call to order this meeting of the Dunn County Health and Human Services Board for September 22nd, 2022. I see that we have several members here on Zoom. Ms. Supervisor Robinson, Supervisor Hagan, and obviously Ms. Morehouse are present. Dr. Hall is here, Ms. Barker, Mr. Lamb. So we do have a quorum. Supervisor Steen is excused. I have not heard from Supervisor Breslin. All right. We are required to have a public hearing on the Department of Human Services budget, which we are going to do now. I will call to order the public hearing on the 2023 DHS budget proposal. I assume, Ms. Winter, that it's been duly noticed.
Yes, it has.
All right. And do we, as far as we know, have anyone present?
Just Barbara and Chris are here. I don't know if they want to make a comment on the public hearing.
Okay. All right. Well, and I will turn this over then to you and Sarah to present what you are able to present on the 2023 budget, if that's all right.
Yep. Thank you very much. And Sarah, do you want to pull up the documents? It was recommended that Sarah participate and share the documents. There was some issues with the documents when they were sent out, with some links and challenges with that. And so Sarah's here to help walk through the budget and the links. Hopefully we'll be able to have that. You'll see in front of you a summary up on the screen, a summary of the entire budget for the department. And if you really want that high level look at it, you'll see there that we're projected to have revenue of $15,587,000, $588,000. Oh my gosh, $15,857,993. Apologize, that did not come out right. And then an expense, $15,869,390, which is a difference of $11,397. And if we can go into some of those details to help you understand what that means.
Please do.
Yep. But I didn't know if there's any you wanted on that front page or questions.
Dr. Hall.
So I had a question relates to the numbers that are listed for the 2022 budget. and maybe I'm just not remembering. So, because I know that was this current year's budget, but so when we look at salary and fringe, that's significantly higher than previous years. And so my thinking when I looked at that was maybe from when we had to bring kind of that calls folks in-house. So then I was trying to understand why the expense operations. So I thought that would kind of move from operations to salary and fringe, yet operations stayed pretty much the same compared with previous years.
Sure. I can take a stab at that. And if
Okay.
Sarah wants to add to that, when you look at operation, that includes everything. So we received Cdbg Grant, which was a lot of money that, that you didn't see previous years in there and those kinds of things. So because of all the grant funding, and a lot of that actually was subcontract out to other, people, agencies, or, for example, Menominee Police Department was able to fund some mentoring program, the Hope Project, those kinds of things. So that's all included in there. So it's really hard to see in that snapshot what's all included. And that's why you see such a variance there. But Sarah, do you want to add anything to that?
You are correct. We had just over $1 million in the Cdbg grant that was put into 2022.
Okay, great. So this is good work that we were able to do thanks to getting some amazing grants.
That's
And
correct.
so
That's correct.
our operations in terms of what we typically do went down, but since we were able to do these extra things with grants, that's why that number didn't change very much. Thank you.
Yes.
That's helpful.
It's an excellent question. Thanks for asking it.
Mhm. All right. Any other questions before we move into a little more of the details?
All right, let's go.
Sarah?
Sorry, I'm working off one screen. I'm at a training in Oshkosh, so I'm used to having 3 screens up. So I only have one little one. This is the details. So as Paula explained, each one of those numbers then at this bottom here will total into what makes the grand total on that front summary report. So human services admin, which is the administration. This is where IT puts their maintenance contracts and everything that IT charges out to us in a year, our phones, our internet, all of that IT pays but charges us for it. And here's what they plan on having charge us for 2023. So we'll want to concentrate on column M right now. That'll be your 2023 budget numbers that carry forward to the summary. As I scroll through, you'll see there's nothing in the AMSO here for revenue. The salary and fringe here for AMSO, it's compressed here. I just expanded it for you so you could see it. If there's any questions, please feel free to jump in, interrupt me, stop me. So whatever you want to look at or what detail you want to see.
Any
I'm
questions
sorry,
on this so far?
I'm sorry, we should concentrate on the sum of the budget column M. I see the other one is versus 2022, so you see the
Yeah.
negative. So please
Yeah.
look at column L.
And does everyone understand what AMSO is when Sarah said AMSO, what that means? That's really our overhead of our program. So all of those people that work in the department that cannot be billed to a specific program, for example, my costs are underneath AMSO, fiscal's costs are underneath AMSO,
ID.
IT support staff, all of that.
So our total between our revenue and our expense for AMSO leaves a difference of 33,516, which last year being 2022, this year, I guess, was the difference here is we put this 250 in here to help cover us for end of the year stuff like we're getting to right now when we can't bring budget adjustments forward because the board doesn't meet and they can't make it through the process. We take the funds out of here and then separate them into grants. So at the end of the year, you'll see this amount change. And we have the matching revenue up above. So it's a 0 net. If we don't get any extra grants in October, November, or December, we don't spend any of this. Just to make that clear. Any questions on AMSO? Okay, I'll scroll up. Here is where the Cdbg grant will be for 2023. The projection is to have $918,687 in the Cdbg grant, and then that's allocated to these expenses.
And I did want to note that we've been working with the Department of Administration on Cdbg, and because of some slow startup, they weren't able to get the housing, the houses rented out and those kinds of things in the beginning. We did have some extra funds that we weren't able to expend for those purposes, and so we are giving back $270,000 in that grant. And with that, they've allowed us to work with the grant longer than the May time period that we had originally that was originally in the grant until the end of 2023. So that was kind of a, we'll give you, you give us kind of thing.
Okay.
And so we worked with that negotiation. So in here, you'll notice that it was $270,000 less than what we had projected with that. So.
Okay, so any questions on support services grants? Hearing none, I will move forward. Here is an allocation that we're going to put into behavioral health, and this is the tax levy. This just gets dumped in here to cover all of the cost centers within behavioral health, being CSP, crisis, and then the behavioral health grants that doesn't make up all the grant funds that we get into our expenses. So that's where this comes into this cost center. The salary and fringe, if I can get my cursor to move here, is in here. Did it go away? Oh, came back way up there. Sorry about that. Oh, it did here. This is multiple people that are in here that go to multiple cost centers within behavioral health. So I'm going to say it's probably Sarah Olinger because she works a little bit in CCS and then she's part of the FEP manager for grants. So we put her up here because she completes a time study and then the costs are allocated directly once her time study is turned in and it claimed correctly to the grants. So that's why she is up here. There isn't any operations in the straight behavioral health cost center because we apply those to grants or direct programs being CCS, CSP, or crisis. So that's why there's no expense to there. And then you'll see the negative 494 because of the expense of Sarah's salary plus the revenue gives us the negative 494 because the other cost centers have more expenses that are not allocated out. Any questions on that cost center? Okay, we'll move to comprehensive community services. Paula and I have been working on version 2 of the budget. We still have some questions to work through. So this revenue was put in for CCS and we think we over projected this one. So we're going to go through our numbers one more time. We're in round 2, clean all that up. And so we have a revenue of $2,582,222. The expenses of the salary and fringe come to 1.5. And then our operations are here. So you'll see a overage of $979,531. Up in the 2.5 million, there is a calculation of WIMCR is in there, plus we bill out services for our mental health clinic that does see our CCS clients. And again, I said in round 2, we will be looking at this number closer to make sure we're correct on what we have for expenses and revenue. But CCS is 100% reimbursable program.
Right.
So there's no tax levy applied to that program. Any questions on CCS? Hearing none, I'll scroll forward. We have our crisis program. So we can bill Medicaid for crisis, plus there's some tax levy within this one. And our salary and fringe. I think we have one person in crisis, 1 or 2 FTEs in crisis, plus the management that handles the operation side of crisis to come up to the 100,132. In here, we have our expenses for crisis. This is paid to Northwest Connections for our crisis line. Any questions on that? Okay, we'll roll forward to CSP. So we can bill CSP to all, this is our revenue source for CSP, plus our tax levy for CSP. Then we have salary and fringe for the staff that help with our CSP consumers. That comes up to the 358,630. Then the operational piece of CSP, the expenses that we have toward the program.
I have a question.
Oh,
Sarah?
sure.
Dr. Hull.
Sorry. So I see the projected salary and fringe is quite a bit lower for 2023 than 2022. So I'm wondering what the change might be there that's causing that.
Yep, it looks like we might have had 1%. There's a lower salary, so a projection of somebody's salary, they might spend less time in CSP. So we could have moved them out, or we have a new person that started in CSP, which started at a lower grade than a person that moved out, an employee that moved out. And I also see our updated work comp numbers. You can see last year, our work comp numbers was 10,903. This year for 2023 projected to be 9,318. So a couple differences in price, and it looks also like our health insurance, maybe somebody dropped a family plan to a single plan. There's 20,000, which is probably about a single person's plan that could have the differences between there.
Thank you.
You are welcome. Any other questions? Great question. Okay, scroll forward. Here comes behavioral health grants. These are all of our grants within the Department of Human Services within the behavioral health. So we get, along with billing public charges for services, anybody that has insurance or pays toward their cost of care, we have it in here. So here's our state grants, but we also track separately our IMD placements of where we can get reimbursement from the state of when they get collection from a consumer that is in an IMD placement. The 198,000 does not cover the full cost of the person's care when they are in an IMD, but it does offset it a little bit. So for behavioral health grants, we collect $2,551,499 projected to for 2023 that we have in the budget. Our salary and fringe for all the programs that are in here come to $908,868. So here's our expense operations for the department. Was there a question?
No, Sarah, go ahead.
No. Okay. All right. Sorry, I heard something and I didn't want to miss a question. And here is what I spoke above the institution for mental disease, the IMD placement. Well, this is roughly what the cost is that we have out there right now for a 2023 expense. Last year we put 470. This year for 2023 we put 450,000. All of these numbers for this one, just they move around depending on how long people stay there. Can really jack the price up or have it go down. So I know, Paula, you can probably speak to why this number went up so much. I think we had a conversation about that. The CBRF. I think we talked, there's a consumer in there that we don't see moving.
Yes. We do have someone that is in the facility and they've been in there for this year, and we do not see moving out of the CBRF. And so that's why you see that number up higher. It is offset a little bit by the number below it, decreased with the Arbor Place funding because the state made Arbor Place a card service. So the treatment part of Arbor Place or LA Phillips is now paid for underneath that card service, and the room and board is what is remaining. And so that did lower the cost for us in that area. So we're able to offset a little bit.
Excuse me, Paula, clarification on card service?
Card service like your Badger Care, Medicare. Yep.
All right.
Sorry.
Thank you.
Yeah. Mhm,
Thank you.
mhm. Yep.
Okay, so we'll scroll down a little bit more to the rest of the expenses that are in behavioral health grants. This one, we lowered the operating supplies on here. I believe there was a one-time grant that was in 2022's numbers, and we won't have that grant in 2023. So we decreased that. Are there any specific questions on behavioral health grants?
Dr. Hall.
Sarah, maybe I missed it and you talked about it already, but it looks like agency contracts are also projected to be significantly higher. Line 276.
276. 276 or 376?
Oh, you know what? I have 276. So I wonder
Hmm.
if I'm looking at the wrong thing. No, it's under
Okay.
behavioral health grants.
Okay, so 399, it's on my screen.
Oh, sorry, yours is different.
No, that's okay. I was like, oh, I went over it. I could look into the detail of that. Why it's higher. We could have a special grant that's going to be coming in 2023. I don't know if Chris can recall if there's one. Is Chris there?
Yep.
Yes, she is.
Yep.
I thought I heard her, but if she could recall if there's a special grant we think we're going to get in 23 or it's rolling forward from 22 to 23.
I think those are increased FEP
Okay.
All
All
for
right.
the first episode psychosis grant.
Oh,
We got an
perfect.
extra, I don't know, $379,000 or something
Okay.
from that program. Some of it went into staffing, but a lot of the staffing is the peer supports that we get from Milkweed Connection and the employment, those would be our staff. Probably peer supports would be the largest part of that.
Thank you.
Okay. Thank you. Yep. I thought there was one, but I couldn't recall which one it might have been called. So thank you, Chris. Was there any more questions? Okay, we'll keep moving along. Now we'll move to Family and Children's Cost Center. This one is tax levy. We put this in here again as, because it's not associated, we didn't associate with any other grants, but it covers where our grants don't cover all of our expenses. So we put it up in here for just the straight Family and Children's Cost Center. These salary and fringes that are in here, this is probably Lori and Carrie as managers of the Family and Children's Costs section, because they get split out to many different grants covering the staff that are in that section. So we put them up here and then they're claimed accurately to the way the staff spend their time. Okay, so we move to Family and Children's Grants section. So here's the grants and where we get all of our revenue from. Some of this is child support, the public charge for service when parents pay for child support. Paula, did you want to talk about those changes coming that might be coming, or do you want to wait till the second round?
Well, in the second round that we're working on, there is potential changes with child support where they are talking about no longer charging parents that have children in care the cost of care because they believe that it differs from their ability to work towards having the children return back home. So money that they would spend on trying to do things like, visit, having the family time, those kinds of things, gas money for that, all of that, then takes that away from being able to do that with the children. So there is, strong language right now that's coming out that would potentially take that away, but that's good that we can be able to do that. The deficit here certainly hits our budget though, because we do receive that funding to help offset the cost of care for children. So.
Okay, so then we'll move to expenses in Family and Children's. This is the salary and fringe. This covers all the staff that work in the Family and Children's section. There's an increase in the health insurance. We've had some staff that are now probably taking family insurance. So you'll see an increase there for that. We'll scroll down to the operation piece. Just let me know if you see anything that stands out that you want to question. Is there any questions on the Family and Children's? Hearing none, I will keep going. This takes us to our economic support section, also known as income maintenance. So here we have some miscellaneous salary and fringe for staff that do time reporting, those kind of things that are not, they're in programs, but we just can't direct them to certain grants until after they complete their time reports. Most of, or I should say all of the stuff that comes from economic support is grant funded. We have PPACA and then our state, which is with our consortium from Eau Claire County. That's those, and a little bit of childcare is in there. Here's the salary and fringe for the economic support section. And then our operational piece. Very minimal expenses, a little bit of postage, office supplies, background checks, drug testing.
I will comment on the drug testing right now, and since the pandemic. They have not been doing drug testing because that was lifted during the pandemic. And as soon as the emergency declaration is lifted, people that have had drug offenses that are on food share will have to go back to drug testing. And so then that increased our cost in that area. It's about $30, the place where we're looking at contracting with, because the previous place no longer does that here in this community. And so that's about $30 per test for that. So as soon as that's lifted, and there's some conversation, nobody knows for sure, but potentially at the beginning of the year.
Thank you, Paula.
Yes,
Are there
Dr.
any
Hall, please
questions?
go ahead.
So thanks. I have a question for Paula actually about that. So the current, the requirement that will go back to being enforced, that they get drug tested in order to receive benefits. And then are those benefits then also contingent, like if they test positive, then do they not receive benefits?
Mhm. Right, their benefits can be stopped at that point, and they have to be tested for the type of drug and it has to be a felony level offense, and whatever the type of drug that they were charged or convicted of, we have to test for that type of drug. Mhm.
And are we able to only test for that
No,
specific
we can
type?
do the panel,
Uh-huh.
yeah.
Just seemed like,
But
oh,
it has to include that type.
oh, you're ill with drug dependency, so we'll take your food away.
Right,
Okay.
exactly.
Right, yeah,
Thanks.
it's
That's
challenging,
right.
That's real challenging.
it's challenging. Mhm.
Okay.
Are there any more questions on the economic support section? Okay, I'll keep scrolling along. This will start our ADRC. So that's broken up into nutrition, aging and disability, and then the ADRC grants, which some and most of the nutrition goes into the grant section. We do get a little bit of donations. We keep this $2,500 in here for revenue, and you can see the offsetting expense that comes with that. So if we don't get the funds for any donations, we won't spend anything within the donation expense. Then we have some salary and fringe that is here in the nutrition services. This is for staff that are divided between C1, C2, which is home delivered meals and congregate meals. And it just depends how they spend their time. And then we claim that accurately, but we don't differentiate that on SAP. So it comes through the salary and fringe this way. Any questions on that little section? Okay, I'll keep rolling forward. Aging and disability is similar. We have a placeholder for $2,500 in donations. There's an offsetting expense down here for that. Here's the salary and fringe of the staff that do time reporting. In ADRC, it's required that they do 15-minute increment. That here's the rest of the salary and fringe that for staff that can be directly allocated to the services that they provide, a 1-to-1 or a 50-50 match, and then we can put them directly in SAP. Go down to our expenses for the aging and disability grants. Just let me know if you see anything that you want to discuss a little bit further. Most of the costs stayed the same from 2022 to 2023 when we did our projections. Any questions on that cost center? Okay, I'll keep scrolling down. We'll start our children disability cost center. This is also known as our CLTS program. This is mostly, it's all state grants. So then we have, I'll say 4 staff, I believe, with a manager within there that we've increased our caseload. So we've had to increase our staff in that section. That's why you will see the increase here. Some of these staff used to be dual. They used to do CCS and CLTS. I think there's a change coming forward to move them to one program or the other. And that's why you'll see the increases here.
But as Sarah said, it is a fully funded program, other than there's a amount that we do have to pay. It's called the maintenance of effort portion, and we can use our COP funding to help offset that. But no matter how many staff you have working in the program, we still pay the same amount. So the state said you can't have a wait list. So we're working on trying to get that down and serve all the kids in the county. So.
Thank you, Paula. We'll go down to our expenses for the program. You won't see a lot of expenses within this program because most of them are a third-party administrator, which mean the providers bill the insurance, which is called WPS, directly, and it doesn't come through our tracking. We do a little bit with home mods and adaptive equipment, and that's what you'll see here. And then we get reimbursed when we bill WPS for the services that we provide for the family. Any questions on that? Okay. The grant here in children's disability is what Paula spoke of. This is our CCOP, which we can use as a match to our maintenance of effort for the CLTS program. There's a few expenses that come with that to offset that. Any questions on that? Okay, we'll come to our last cost center within DHS, which is our Birth to 3 program. So here's the levy for that. That's just in our straight Birth to 3. Again, we don't allocate that to the grant within this piece. And then here is the revenue we collect to the program. The $133,275 is the grant for the Birth to 3 program. These are the insurances that we're able to bill for the program. And we do get a little, the $500 is from Knights of Columbus, which used to be called the Tootsie Roll Grant. So we do get those. This is the salary and fringe for the staff that are allocated to Birth to 3. And these are the expenses within that program. Are there any questions on that? I know I went through it pretty quickly.
So when you look at the revenue from the state compared to what the expenses are and how much the county does have to pay, you know why it's on the legislative agenda as an issue that needs to be fixed, right? So I'm just trying to tie those pieces together for you. Mm-hmm.
Right, I mean, that's a significant drop in the state grant.
Mm-hmm.
Mm-hmm.
Yeah, they gave us extra money in 2022. You'll see for 2022, it says 181, and then it went back to the original allocation of what it was in 2021.
Mm-hmm.
So I believe this is, Chris can correct me if I'm wrong, but I think this was due to COVID. I think they increased it a little bit.
There was an ARPA grant.
Yep.
Mm-hmm. But it still comes nowhere close to covering the cost of the program. Right.
No. Are there any other questions? This was just how we linked the spreadsheet together to get what we could get to our 2023 year. So this was just an extra spreadsheet that held all our detailed data. And that brings us back to our summary. You'll see the 11,397 again.
And as Sarah stated, we are working on a draft too. We did receive some funding for the FEP grant again. But on the other hand, we've seen things like food costs go way up for our nutrition program and other things that we're having to just really tweak and look at as far as what those costs are. Some of the things that we weren't aware of, at the beginning of the, or, when this was started to work on, we're, we went line by line through it. For several hours this week, Sarah and Jerry and I have, and looked at it, but it wasn't in a place to be able to bring it forward yet because we still have a little more work to do on it yet, but we will have to do some adjustments because of those things.
And those adjustments will probably be ready to go to executive committee in October.
Sure.
Early, what is the date? It's the 14th or the 11th or. Yeah.
Yep, I stated wrong. It wasn't a FEP grant. It was a family treatment court grant. I apologize. I said the wrong initials. So, yeah.
Are there any other questions? And have we had any other, are there any comments? Any other comments? All right. Any more questions from the committee on the budget? If not, then I will adjourn the public hearing for today, and we will move on with the rest of our agenda. And thank you for taking the budget so seriously. It's a big deal.
Paula, would you like me to stick around for anything?
Oh, go eat,
I think-
Sarah. Go
I think
eat.
we are okay, and we really very much appreciate your help, Sarah. Thanks very
All
much.
right. Thank you. You guys have a good night.
Yeah, you
Thank
too.
you.
You too. I assume, Paula, that we don't have any general public comment.
We do not.
Okay. And our next meeting is October 27th, again, the fourth Thursday. Is that all right with everybody?
Can we approve the meeting minutes though?
Oops, we
There's one.
didn't. I just kind of scrolled right by that. Thank you very much.
Apologize for interrupting.
Yes, so we have minutes. They were in your packet of our August 25th, 2022 meeting. They're excellent minutes. Any move approval, Mr. Lamb? Is there a second? Supervisor Hagan, any additions or corrections? If not, all in favor, say aye.
Aye.
Aye. Minutes
Aye.
August 25th are approved. Thank you, Supervisor Robinson. And thank you for not allowing me to scroll by that. Okay, next meeting, October 27th. That moves us up to item 7. Oh,
Chairperson,
I'm sorry.
I'm sorry to say that I will be at my son's honors choir concert in Madison that evening. Sorry.
I think that is a legitimate excuse. All right. And maybe we could all zoom in.
Mhm.
Yeah.
All right. Item 7 is the legislative agenda, which we discussed probably at too much length last meeting. Just as a way of describing to the committee the county's general operating procedure with regard to the legislative agenda, that each standing committee develops items which goes into a compiled legislative agenda, which gets distributed to our state legislators and discussed at a meeting that will be in January or February of this year. So we have our legislative agenda. This is the second time that you've had a chance to look at it. And you probably won't like me, but I think what we ought to do is go through each item as quickly as we can to say, leave it in, take it out, or change it. I don't think we need to do any kind of editing here, but if there are things that you are uncomfortable with, then the staff could take the lead in doing some edits. So first item A, cost of child welfare services, increase the children and families allocation CFA up to 20 million or a 20% increase. In, out, in, any changes? All right, it stays in. B, increase funding to aging and disability resource centers in the amount of 32 million to reduce inequities in funding, et cetera, et cetera. In,
Yes.
yes? Any changes? All right. C, and I can't imagine there's going to be much discussion on this one, but provide a $4 million increase in birth to 3 state allocation, et cetera, et cetera. In, birth to 3?
Yes.
All right. Any changes in it? All right. D, continued support for Medicaid expansion in Wisconsin by accepting $1.6 million in federal support. In?
Absolutely.
Out, any changes? Okay, good. E deals with mental health. Provide additional state GPR to be provided to fully fund crisis intervention services statewide to provide services in the least restrictive environment. Yes, from Ms. Barker, yes, yes, in, all right. Excellent. F, increase Medicaid reimbursement rates for mental health providers.
Yes.
That's still in, all right. Any changes on that one? All right, now we move a bit to public health. Preserve the statutory authority of public health agencies for control of communicable diseases and other public health threats. Is that in or out?
In.
In, all right. KT, if you want us to suggest any changes, just weigh in. H, advocate for expanded funding for county public health departments, staffing for communicable disease investigations, and to continue to follow up cases of COVID-19. Dr. Hall.
How did you know? So I had a question because the verbiage here is to continue to follow up cases of COVID-19. And in terms of case investigations and things like that, that's no longer something that county health departments are doing on the regular. So I'm just wondering if we need to look at rewording this statement. And so KT, I'd be interested in your opinion on that.
Sure. So we continue to follow up with folks that are 60 or better. We find that due to technology barriers and maybe access barriers, there's still a lot of gratitude when we make that phone call, make sure that there isn't any challenges to isolate or any questions about being connected to care. That being said, it's not case tracing like we did last year even. It's really just to support that individual. But to your point, Dr. Hall, I think that communicable disease is a mandated service for local health departments. Before 2018, there was no funding to local health departments before that. After 2018, we received a whopping $4,500 for those activities in Dunn County. So I think maybe to make this broader into a more comprehensive case follow-up and communicable disease follow-up would be maybe prudent.
All right, so we'll put that on our task list to maybe beef this one up a little bit. Yeah.
Yeah, just make it a little bit more general rather than COVID-19
Absolutely.
specific would be great.
Communicable disease.
Just communicable disease investigation and follow-up.
Yeah.
Yeah,
Work.
absolutely. So for example, we have no additional funding for monkeypox follow-up, right? So this would be
Right.
helpful.
Okay, we will make some amendments on that, and I will so note here. Provide at least $36 million in funding to support public health infrastructure in the state, with half of the funding allocated to local public health agencies. In, out, amended. Dr. Hall. You're the expert
I'm
here.
very chatty this evening, but so my question would be how H and I are different from each other, and in what ways they overlap and in what ways they don't. So maybe KT, if you could help with that as well.
Sure. So there's a current federal grant that the state has applied for in public health infrastructure, with a dedicated 40% of that funding for workforce development going to locals. So I would share that that's just expected to happen, and I expect to have an award by the end of this year. But I think putting this in the legislative agenda would be helpful to say that you guys see value in that. I would say that public health infrastructure is larger than communicable disease. That is not all that we do, even within our public health nursing responsibilities. And I think that it's helpful to have a both and approach.
Thank you.
Okay, so we'll leave that in. All right, thank you, committee. Moving on to groundwater assessment and monitoring. This was developed by Mr. Lamb. Additionally, advocate for a statewide groundwater assessment and monitoring initiative. We are going to be using some of our ARPA funds in the county for groundwater monitoring, but this would be a bigger statewide monitoring initiative. Additionally, fund mitigation of problems that are identified in such assessment and secure funding for long-term private drinking water protection. In or out? In. All right. Request DNR establish, we probably should say request the DNR, but anyway, establish standards for PFAS levels and monitoring methods and provide appropriate responses to PFAS contamination in drinking water, groundwater, and surface water. Does that stay in? Dr. Hall.
So I have another question, and apologies that I don't remember, but did I recently see that maybe the EPA came out with new standards? That there are some standards now that have just recently come out? Okay. I'm pretty sure it wasn't at the state level, so I think it makes sense, but we might need to look into this and see if we need to update this item to perhaps look at, I think it's EPA, but it could be another federal agency, and look at whether we want them to follow the federal standards or establish their own.
This actually was a recommendation that came out of a statewide water quality task force, but was not implemented, was not funded. So we just have sort of left it intact.
Well, and certainly it's not harmful to want to do this at the state level, because we might come up with different values that we think are appropriate and different
Absolutely.
systems for
Absolutely.
monitoring and response. So, okay, great. Thanks.
Okay, then we have two for veteran services. Support in county veteran services officer grant funds to mitigate the impacts of static funding for well over 10 years. Does that stay in?
Yes.
Changes, Greg?
No changes other than they did increase it
A little.
this last year. However, I think
$1,000.
yeah, I think it should be incorporated into just a continual cost of living adjustment for those services.
Okay. And the item M, advocate and support the federal funding for county veteran services offices. I did send a suggestion yesterday to deal with the legislation that you suggested was in markup. I'm not sure that it changed much of this. There's never been federal funding for county veterans services offices, which is ridiculous since almost all the work you do relates to the feds.
I can just elaborate a little bit on the legislation in the House of Representatives. It's basically to help establish county veteran service offices in areas that don't have them to reach those veterans, and then enhance the services in some of the areas that already have it existing. And the bottom line is if the commitment is to reach veterans, there's no better way to spend federal money than to put it locally, because they're going to know the population better.
Yeah, and as I read that legislation, it would require the state of Wisconsin to apply for a grant. And maybe we should say that to encourage let's amend that a little bit to encourage the state to actually apply for the grant, and even they could decide that they don't think it's important, and it is.
That's what I was wondering, because the legislature can say whatever they want, but they mean it.
And then we added this one in. Request an increase of GPR funding to counties for adult protection services proportionate with the increase in the at-risk population. A $10 million increase would bring the state share to about half of the total APS funding, et cetera, et cetera. Does that stay in?
Yes.
All right. Any changes on that one? All right. I think our legislative agenda might be the longest of any of the standing committees, but thanks for the review, and let's. Really? Okay, Dr. Hall.
I'm so chatty this evening.
It's all right. That's your
so,
job.
I really appreciated getting this Wisconsin County Human Services Association document. They did such a beautiful job with the background and,
Yeah.
and the current status. And so I guess I just wanted to say my hope is that when they meet with the legislators, that this document will go as well. And then just a comment, I don't know what the agenda is for the day when they host the legislators. But I wonder if we should challenge the different departments in the county to come up with, here are some things that are going great. And let us tell you some things that are really great, or some programs that we have in the state that are really making a difference in people's lives. So kind of the things that we've started doing in this meeting, right? And that we're seeing a lot in the reports is here are some stories of the positive impacts that the work that is already happening thanks to the statutes, the programs, the grants that exist. Because if I were a legislator and I'm just going to go to yet another meeting where people are going to ask me for more money that I may or may not be able to deliver, that might not feel really fun, and I might tune out.
That does happen.
Right. But if we start with, hey, thank you. We have this program and this funding for this, this fully funded program by the state, right? So, we talked about some of them earlier when we looked at the human services budget. Like, look at what we're able to do for the children long-term care services, and we have more children with needs, and we're so grateful that the funding that we need will come for that. So if we can also ask the whoever the folks are from the county who are meeting with them to highlight some of the wins and some of the things like, this is awesome, don't let this go away. I think, a lesson many of us have become aware of is that, things can go away.
Well, and true. And with the assent of the legislative committee and the county manager, I think that's an excellent idea, to pair a request for more money with some stories of the excellent work that we do.
Right. Sandwich it, right? Start off with something really good and positive, and this is awesome. And here's a few other things that if we could tweak these, we could do so much more for the citizens of the state. And again, thank you, because these programs rock. And now we just need to tweak a few other
Absolutely.
things.
An excellent suggestion, Dr. Hall. I appreciate it. All right. This will go to the legislative committee, which is basically the county executive committee, and then go into the compiled document. And we will work on a presentation as we get closer to the session in the winter. Excuse me, in the winter.
May I ask a question?
Yes, certainly.
I don't know if this is going to be relevant or not. I apologize if it isn't, but a lot of the things we went over are monetary concerns at the state level, which makes sense. But I was wondering, are there anything that are kind of tying the hands of services that could be addressed for
Levy.
Well, for example,
Levy.
like,
Levy.
well, what I'm talking about is just as an example, earlier, we were talking about the drug testing and the cutting off of services in case somebody tests positive, which means is tying the hands of us to say that, that person cannot get this help anymore, whereas they may need that help in order to not fall back onto bad habits. And so is there anything non-monetary in that sense that maybe we could look into so that any services that we can provide could be opened up to help other people that may not necessarily
I'd say my advice on that would be, since our list
Correct.
is pretty lengthy, let's take a look at some of those things. And as we think about kind of an ongoing agenda in this committee, sort of think about those things that that help the work that these departments do, but also things that might hinder our success. It's a good suggestion.
Thank you.
Yeah, thank you.
Chair Morehouse, would that be more along the lines of looking at policy?
Yeah,
Rather-
absolutely. All right. We'll move that on. And that moves us to item 8, which is veteran service. Greg.
Good evening, everyone. I'll start off with the narrative memorandum page, that just a basic roll up of activities over the last months. And I'll start off with local activities. And the first thing we had one homeless veteran, which we've dealt with a couple with very significant barriers in the past few months that I'd already reported on. And this was again a very similar situation with significant barriers. Layered fundings layered some funding with Center for Veterans Issues, which is a grant funded program at state level, but they have a local outreach folks, as well as the Veterans Outreach and Recovery Program. And long story short is they had paid for a number of months of hotel trying to find housing. We came on board as the funder of last resort, started helping, and thankfully they're able to find a transitional housing. And so now the veteran is housed. The other thing I'd already reported on this, but I reported verbally. I just put it in writing this time about the Neilsville High Ground bike tour, but a few other local things, which if you watched WQOW, you might have seen something regarding the Heats On program. We've been involved in that ever since 11 years. And so we work with the local 434 pipe fitters union out of Eau Claire. We ended up having, it's a little early in the heating season this year. Normally we're around that end of October, early November, but we always keep a list of veterans that and surviving spouses that could definitely benefit. And so what their whole goal is to get out early in the heating season to do an inspection, check filters for veterans specifically and their surviving spouses. And so we had 13 in Dunn County that were helped. Great to work with. This will be ongoing, I hope, as long as I'm here. Really an incredible piece to that is one was a surviving spouse. And actually, she was one of our impact stories because it was very reluctant to get any services from anyone identified as federal government. But she was willing to do this, and so out in some of our rural communities, we have lots of labeled HVAC electricians and contractors that are self-labeled, and so they had a furnace put in by an electrician. And it was and anyway, so it was only operating at 20% efficiency, and they were going to spend they were planning on spending, it was about $4,000 to replace it, and so they felt the pipe fitters union that had called me and just said, hey, we just saved about $4,000. All they had to do is just do some adjustments, increase pressure. So it was good to hear that. They were very happy to know that they didn't need to replace it. They just needed it done right. And but that's what happens in the rural area. I'm part of some of those communities. They try to do everything themselves. So that was very, very good. It come at a great time. And there's others certainly that benefited from them cleaning up their furnaces and doing a couple of repairs on that. We also attended Chippewa Valley Tech Welcome Back for their veteran students, just to have a presence there. And that was last week. Scheduled next week. They do the similar thing at UW Stout. So I'll be down there for a few hours. And that's really a healthcare enrollment focus, because they want to hit they're still considered non-traditional, but younger students to help save them some money, to get them involved in the healthcare It's a. So that'll, so I agreed to do that. That'll be at the end of the month and it's an hour block of instruction we're required to go through as part of our continuing education to keep our accreditation. So that'll be good to be able to instill some of the Dunn County values at the state level.
Great.
And then also I had included a rather large document. I'm just going to highlight really the bluff on that, the bottom line up front. It's the Governor's Blue Ribbon Commission document. And it was an executive order, February 2022, Governor Evers created a commission on to really look at veteran opportunity, and they wanted to gather information, listening sessions, and within the document, you can see the number of individuals that participated in that to help develop the document. From that, really to summarize it, the report, and I'm going to read it, and I just because I have it highlighted on mine, but just a quick paragraph. The report promotes relationship building, mentorship between older and younger veterans. And this is the recommendation going back to the governor. Resources, structures for families, partnerships across veteran age groups in the workforce. With these underpinnings, they recommend enhanced funding for veteran services on campuses, increased family participation in post-secondary programs, strategies for improved long-term care recruitment, pre-eviction housing assistance, tax relief, increased clinical and service intensive offerings for veterans experiencing homelessness, family connection funding for county and tribal veteran service officers, expanded mental health outreach services, and grants for supporting to support animal training. So I think, you know, a lot of it from my takeaway is a lot of what the commission discovered is it just confirmed a lot of what the suspicions are, really what's missing. And now, you know, it all comes down to taking action. And again, as I think mentioned earlier, you know, heavy focus on money, but you know, you also can change some policy to put some of your efforts focused in other areas. So I'll kind of be following to see what actually happens with the taking the action, those next steps, because otherwise then having the commission is nothing more than an exercise in group work. So I'll be following that, but there, you know, you have it in your packets, you can read that as you like, but that's basically the summary.
This is really excellent. Thank you for, it's so helpful.
The other, I'll move on to the federal benefits. Big discussions been regarding the newest legislation regarding the PACT Act. I had included a couple page document to give you a little bit more detail. And by no means would I say that I'm an expert in conveying the information yet, but will be. You know, that's part of what we need to do is to digest all the information that's been provided. Next Friday, be in a meeting with some of my cohorts that we're gonna have somebody coming out of the Minneapolis VA. It's gonna talk a little bit more about the PACT Act, but I think they too are at that stage. They know as much as we know that's in print, but the piece that I'm hoping to get from them is the execution phase. You know, how quickly are they ramping up to start working on some of these new additions? So within that, I'm only gonna.
I can tell with the lawyers, I mean, the advertisements on TV at this point have gotten ridiculous. It's kind of like, oh my goodness.
Yeah, it's feeding frenzy for sure.
It is.
Yeah, and I know, and I know I think I'm supposed to stay middle of the ground on things, but I do think that there should not be that much money allocated to assisting people to get a benefit or an entitlement that has already been ordered.
Exactly.
You're eligible. So
Exactly.
that's just the balance. Yeah, and complicating forms and process to put that layer in to have somebody, you know, even on my level, you know, we have to, it's so complicated to fill out federal forms. And I'm sure I'm speaking to everybody in here who's been through it. It shouldn't be that complicated. So, but we're here to help. And I too am trying to advise people cautiously through the process. But in the end, if you got to pay 40% to get something that you've earned, and that's the best process, it's better than nothing. So we'll continue to help support people through that.
I thought the timeline on this document was helpful. I
Yeah,
think it's probably
yeah.
pretty optimistic, but
Yeah, I would agree. On our end, it's foot's on the gas. You know, we have a responsibility to start assisting, and I'll speak specifically to the Vietnam veterans with submitting disability claims for hypertension. We've already started. We're not concerned about their timeline and processing. We're concerned in showing our efforts for the veterans in our community to, again, action, not just what's on the news and what's in paper. Here's the action we're taking. We'll get these in and then track it. But I would, on the document that's titled Understanding the Healthcare Eligibility and Benefits, underneath the benefits side, it's just a nice roll up of the presumptive diseases related they added for the newer and Gulf War veterans. And then in a smaller paragraph, they added, it just discussed that in the hypertension and the monoclonal gammopathy for Vietnam veterans. And again, there's more information in here. I'm not going to go in detail, but that's an area where just to become familiar with what is available. And again, and you look at the list, it really confirms the hazardous exposures that, you know, and you always do casualty estimates before you go in and do any type of work in the military. And the casualty estimates, this is part of it. And so, you know, that's our government's commitment. And so we're going to assist through that whole process. On the, I'll move to the, one other local thing. I apologize. Just this Saturday, Cedarbrook Church is having basically it's a men's trauma event. And they have a veteran speaker that's coming in, and it's open to more than just veterans. It's open because trauma is experienced by a lot of our emergency management folks, police. So it's open to all of them. We're going to have a table at it, so I'll be there just in that, in case people want to talk about some benefits and stuff. And so I'll throw that out there to my cohorts. If you want me to throw some things on my table, I certainly can, if you're trying to promote something, business cards or whatever. So I do that. I'll put that together tomorrow. So I'll move to the financial. If there's no questions, I'll move to actually not the financial, the document normally where I have the impact statement. So I feel like I failed because you emphasize impact statements or, hey, some of the good stuff, and I didn't put it. I just put in the placeholder of nothing significant to report. So
and we don't believe you.
There's always significant things to report. But
Well, that
for
first
this,
paragraph about the homeless gentleman.
yeah,
I mean, right, that's huge. That's wonderful news.
yeah, I could have probably transferred that over over there, but again, in that document, we're tracking when we get back pay awards for veterans, so we're including that in there, and then the contacts that we have and the number of active claims that are happening. So, you know, business is picking up, certainly. And thankfully we have an intern second semester. So there's so much more value when you have a person that's already familiar with the business practices within the office. And so we're able to get a lot of extra help and support from her. She actually put together our heats on list and contacted all those folks. So that takes a little bit of time. So that was helpful. If there's no questions related, yeah.
I just had a question about the medical loan equipment closet again. I noticed the numbers have been pretty steady for the past, for the year or so. I was just curious, the people that rent from the closet, has it been like the same people over the course of the year, or has it been different people on and off? I suppose what I'm asking is, has there been any trends of certain people coming in that may need this equipment that they're being loaned, like on a more permanent basis? Has any of that been coming up?
a trend is delay with Medicare in obtaining your permanent piece of equipment. Example, wheelchair. And so sometimes there, and a lot of times I will have some of the representatives, I'll say from Inclusa will come in, they're trying to bridge time. And so that's a trend, but not specific. There's not any one individual, because when you get a new knee, you get a new knee, and you hope you don't have to do it again. And there's somebody else. And thankfully the local hospitals are aware of, and their social workers are aware of what we have. So when they're trying to discharge people and they may not have items to be able to head home, they're coming over again to save money, because it's on a temporary basis. Nobody wants to spend $400 to go ahead and make their access to their home or how they can ambulate to the bathroom, if it's only on a basis. So the only trend I would say is some of the delays in getting the actual permanent equipment from the insurance companies. That's consistent.
Okay, thank you.
Yep. If there's no further questions, the budget, that is the true nothing significant to report. We're I see no concerns as we head into really the last quarter of the year that I think are noteworthy in reporting. The expectation should be that we'll come in under or right on the budget that we estimated for this year.
Good, thank you. Any questions on budget expenses or revenues for Greg? Yes. Mr. Lamb.
Not a question on that, but just something I wanted to relate to everyone, that Mr. Quinn received some, and I don't know if Greg would have seen this. I know he knows what he was able to help someone with, but I thought I'd share this real quick. This friend / acquaintance of mine about a week ago shared on Facebook that he was going to receive, he was in Vietnam, he's going to receive a Purple Heart over some tinnitus or something. And he's made specific reference about we're blessed in Dunn County to have Greg Quinn as the Veteran Service Officer. And I said, absolutely. And then about a week, 2-3 days later, I came back just to check. And there was a lot of other comments on there talking about how lucky we are to have Greg. So I wanted to.
I don't have Facebook. So I don't have any social media.
Maybe you should.
Yeah, well, everyone,
No
so
chance.
there was not one negative
Yeah.
comment and all just a lot of love. So I wanted to share that.
But I know exactly who you're talking about. We're working on that piece. We always get anything a shot. We're here to earn the money we're paid, right?
Well, you certainly
thank you.
do that.
Thank you. That concludes what I have.
All right, thank you. As always, excellent. All right, KT, it devolves to item 9, which is the Public Health Department report. And you had materials yesterday?
I did. I sent that out yesterday. Hopefully you guys all had an opportunity to connect with that. I can pull things up on the screen if that would be helpful. Otherwise, I will just
Sure.
speak through. What's your preference?
Let's put it up on the screen.
Okay. All right, so looking at all right, looking at the public health update, you still see our regular update on COVID. I do want to share a couple of things. One, the updated community transmission levels are updated on Thursday evenings. So that has come out already, and there's a reduction in the north central part where you see all of the orange here to more green and gold, really reflecting, in my belief, a reduction in hospitalizations, which I think is good news. Also, that our wastewater treatment facility here in Menominee does continue to monitor for concentrations on COVID-19 gene replication or genetic material, sorry about that. And I would say unexpectedly, there has not been a significant increase since the students have come back. So what that says to me is that there is likely either good infection acquired immunity from a recent Omicron infection, or that people really haven't started being exposed in the same way because the weather has been so very nice. So we'll see how that goes. I also want to share a little bit about the E. coli outbreak that we're tracking. I think it's a challenge when you've got 7 known cases, 6 hospitalizations, and it's national because it's part of a meal kit service. And so just recognizing that the way we consume our food and the way we get our food is changing, and so does the case tracing that happens with these communicable diseases.
Are there Wisconsin cases?
Not at this point.
Thank you.
Wanted to give a shout out to Autumn, who's with us here today as part of our orientation. She has started with us, as part of our NACHO grant, and it's our FEP is different from Human Services FEP. This is Public Health Emergency Preparedness. And so we were funded, awarded that grant, and you guys approved the receipt of that grant to support us going back to our emergency preparedness plans and updating them, since they really haven't been touched due to COVID, to make sure that we are localizing our templates to reflect our current reality.
And Katie, I'm sorry to interrupt, but would you like to take a minute to introduce Autumn since she is with us?
Sure. So Autumn is a recent UW Eau Claire graduate. She has her undergraduate in social work, and she has a minor in public health. She started with us, I'm not sure, 2.5, 3 weeks ago, the first of September. Is there, if you're available, Autumn, is there anything else you'd like to share?
Hi, everyone.
Yes.
Thank you so much for approving this grant and giving me the opportunity to work alongside a lot of the public health folks and really explore what emergency preparedness is. I'm really thankful for this opportunity.
And as I say, we're glad to have you. So thanks, Autumn. Welcome.
Thank you.
Welcome.
Thank you for that, Autumn. And then there's quite a bit in here on Health Done Right, kind of where we are in the process. There's also some of the outreach materials that we're currently putting together for the updated Community Health Improvement Plan. And that was for Health Done Right. And that's a graphic that I had shared. And then a lot of work around public health nursing. And I wanted to share, we are getting ready for flu shot season. Our goal is to have that available to county employees as of next week. And then working to get out into the community where we typically provide shots for folks that have barriers to access in long-term care facilities, at some of our senior centers out in the more rural areas. But then also having that available here at the health department for private pay individuals. That is a reduced cost folks, again, to remove barriers. Wanted to share that we do have the Omicron variant bivalent booster here through our AMI clinics. You guys saw them here tonight.
Yep.
At the county building. They were able to vaccinate 35 people today as of about 6 o'clock. So I'm hopeful that they got a couple more in the last hour. We have 2 more clinics scheduled for the rest of this month. Next week, again, from 1 to 7. And then our October dates have not been approved at this point, but we're hopeful to have a couple of October dates as well. Wanted to share that we have completed Narcan nasal spray training for all of our public health nurses, and our next step is to reach out to our community partners, including Human Services and CJCC, to support them in distributing that to community members in a way an overdose as either a bystander or an accidental exposure for a staff member. And I think that that's really important. And then a little bit of information about environmental health. And I think that this was a really nice consumer client success where we were able to support somebody. We do have the regional radon information center with our environmental health specialists. And we were able to really in real time support somebody that had a radon mitigation system put into their home as part of a contingency for the sale, and it didn't seem to be correct. We were able to connect them with a licensed installer through the state. They also were connected with a subject matter expert from the state, and it was not correctly installed, and so they were able to make those changes almost in real time. And then one last quick check-in was about public health nutrition. Both public health nutrition and public health nursing are showing their commitment to workforce development and supporting practicum for community health rotations, both with a master's prepared dietitian moving towards their RD status and a registered nurse moving towards their BSN status this semester. And so we're really grateful to have them back in our department to help support that work and support their education. All right. And then this was just a copy of the heat outreach material. I will share that we were lucky enough to connect with a couple of stout professors last couple weeks, one with communications and one with environmental science. And so we have some invites to work directly with students on some outreach materials and hopefully engage folks to come spend their time with us in Health Done Right. And then this was one other thing. I oftentimes include this in your packet. I did not, but I wanted to share a couple things about COVID. So I don't think that the pandemic is over, but I will say that for most people, the severity of illness is going down, but not for everybody. So we are seeing still limited metro bed capacity. Oftentimes that's more related to either staffing levels or other like trauma season. But there can be significant challenges for folks that have COVID as well. So we have seen a reduction in the region, but there does continue to be people that are hospitalized with and for COVID both. Any questions on any of that?
Dr. Hall has a question.
Hi, thanks, Katie. So I was interested to see that our hospitalization rate for Dunn County has gone up. And so I was just curious, did we have a bunch of cases perhaps in a nursing home or an elder care facility? Or, you know, I'm just curious as to what's behind those increased hospitalization numbers and if it's something we need to be aware of.
Sure, I appreciate that. So actually this week, what was updated today shows that that has gone back down. But previously, yes, you're right. We did have an increase in hospitalizations. It is the federal numbers are pulled per catchment basin. So, you know, looking at the hospitals, not just in Dunn County, the hospital in Dunn County, but the hospitals in Eau Claire County, Chippewa County, and Dunn County, where the majority of our folks go to. So we tend to track together on hospitalization. So it's a little bit more challenging to put your finger right on, you know, are we seeing an increase? I will share, Dr. Hall, that we have had some consistent cases in a couple of our long-term care facilities, not so much with the hospitalizations associated with them, although there were a couple, but really just a propagated outbreak because Omicron was so contagious. And so I think that that's, it's important that we get folks their Omicron booster and can move forward with providing protection that way.
Thank
I
you.
will also share that I've lost the camera for the room. Maybe it's my internet connection, but I don't see you guys on camera anymore.
I don't think so. I think there's a.
I can no longer see the room either.
Okay, we're
Thank
trying to
you.
work on it. Thank you, Supervisor Robinson.
Okay, we'll make it work. Thank you guys. There you are. Wonderful.
Yeah.
Yeah. Okay, we're all back. Do you want to do budget?
Absolutely. Okay, so hopefully you guys can hear me and see this spreadsheet. So this should look identical to the format that Human Services is now using. It is also connected to the mother of all spreadsheets that actually has lots of fancy logic and pivot tables built in to pull specifically from SAP directly instead of having that concern about individual error as things have to be keyed in. So I understand that it is the first time you guys have seen this for the health department, but it should start to become familiar as it is what Human Services uses as well. So a couple of things that I wanted to share. We have not had the same kind of COVID use for the grant funds. And so we still continue to show a excess with money either going back to levy or being carried forward, depending on whether or not it's grant funded or not. But it is a reduction from last month. I will also share that as we speak through some housekeeping, some financial housekeeping with the budget adjustment that I have forward, those changes will be reflected hopefully in next month's finances as well. Any questions on this?
Yes, Dr.
I'm sorry. So I think it's just I'm having trouble with the new format. So if I could have some assistance understanding just the columns in the first table. So, you know, it says total budget and then year end projected. And so I thought year end projected was always like, if things keep going the way we think they're going, then this is what our year end is going to be. Is that correct still?
That is accurate. Yes.
And so
Correct.
it's very different. So, and I just need to confirm for my tired brain, but so it's very different in terms of revenue for public service and grants. And is that what you alluded to at the beginning, that we have a lot less of that COVID related stuff than we anticipated?
Work. And then also revenue for us, you'll remember that we do the work and then we bill, and then so we do the work. The next month we bill CARS, which is the state system for reporting grants. And then the month after that, then we receive the revenue. So there's always a 2-month lag. We get everything that we bill for by the end of the year, but we might not see, you know, it's September now, and we might be just getting, you know, July, depending on what grant it is from.
Okay. Thank you. And then the big difference between the budget for operations and the year end projected, is that again related to COVID related work?
So I will share that the 2022 budget, when it was first put together, was not in great form. It's ultimately my fault, but there were some significant communication challenges and changes in staffing right before this was submitted. So the 2022 budget, I think, was a little rough, and we are still making that right.
Okay, thank you.
Okay, any further questions on the budget for KT? Anything else, KT?
No, ma'am.
Thank you very much, and get well.
Thanks for being here.
All right. Item 10, Department of Human Services Staff Report, and we have a written report from Paula that's also extremely helpful. I don't know how you want to proceed, but proceed.
Sure, I have a couple things that were not in the report, and so I just want to let you know that we had a fantastic offer from the Veterans Department and Extension that are going to be doing an all-staff responses and be able to provide that report. I think they talked about in the first quarter of the year to be able to get some information out. So that is closed. And then you'll see there was in the packet, both my written report, and then I also included a great document that Chris, I'm going to give her credit because she created it, the allocations and grant document that had, the different programming and how they're funded. And based on the decision or the discussion that we had last month, like how was Birth to Three funded and all of that, I thought, oh, it was good to maybe visit this again and just,
That was
get it
really
in front of
helpful.
you. So that's why it's in there for you just to look at as a point of reference. I'm not gonna, read you my document, but just, some updates. I think this was in KTs too, that the Housing Action, HDR Housing Action team kind of has hit pause for this moment. And then we'll, reconvene after that survey is done. We had a great judges meeting that I participated in along with, Judges Corp Counsel, Barbara was there, district attorney and some staff talking about, the process, how things are going with the courts, what we can do to help better serve individuals. It was really fun to hear the judges talk about and consider things that we're doing that maybe creates trauma for individuals we're seeing in court, and having that compassion for people. That was a lot of fun for me to see that and be part of that. They talked about a recent training they were at and learned, more things about that. And so that was a lot of fun to be part of. CJCC met, and so I discussed that a little bit there. Helping out with Burnett County. They were in a world of hurt. They just hardly had any staff in their families and children units. So, we couldn't do a whole lot, but, helping a little bit with that one worker reaching out and doing the youth justice intake. I wanted to make sure that you're aware of that. Great family treatment court picnic, had lots of people participate, and that was great fun seeing them, and the different stakeholders that were there, Sheriff's Department, fire trucks, all of those kinds of things for people. Talking about financing, I'm continuing to learn the budget and all of the software that goes with that. And I'm breathing deeply because there's a challenge. And then certainly the fun and positive things, I've so much enjoyed meeting people and hearing all of the good success cases that are going on. And I could have filled up several pages, but I tried to hold it to a little bit of each unit, maybe a little bit. So wanted to share that fun stuff going on as well.
And learning the budget process is not aided by the committee chair calling up and saying, what is this? It's not helpful.
No, but necessary because we needed to get it straight. So any questions on my report? Yeah, go ahead.
Thank you. So I was really excited to read about the QRT, the Quick Response Team initiative that's happening. And so I was wondering if you just tell us a little bit more about that, what the status of that program is right now here in Menominee, and what specifically is Human Services contribution to that program?
Sure. Thank you for that great question. So it's multifaceted. So just today we met, and I say we because Barbara was there as well, met with some of our partners along with the software company that is being implemented to provide all of that we're supposed to input all of the consumer information. So lots of HIPAA confidentiality type things, part 2, with that. And so how do we share information? How do we ensure confidentiality? How do we ensure that there's some firewalls and protection and legal things in place that we can share information. So that's one of the big steps that we need to take. And, Barbara will be working with the city attorney, not to point her out, but, a lot of good people and minds working together to make sure that we have all the documentation in place, that consumers are safe and that the county and city is safe also in that. Our role in human services, we have 2 workers that would be part of the QRT. So if there is a situation where an individual overdoses the next day or day following, whenever you're able to have access to them, one of our staff, along with emergency personnel, which could be EMT, fire, and law enforcement, would respond to that individual and have discussions with them, talk about what services could be provided, what is it that they need, in the hope that we're preventing an overdose, or making sure that they're connected with resources as part of that. So a piece of it is getting that the documentation in place, getting, making sure that we have all the training in place and moving forward with that. So that's really our next step, is we want to make sure we're doing things right. So getting the legal stuff done prior to jumping in and doing that. Yeah,
It's really exciting.
it is very exciting. Mhm, mhm.
Yeah, thank you for that question.
One follow-up question is that the COSUP grant, that's what's funding it, the law and grant, is that a Wisconsin state program?
What's law enforcement? It's federal.
It's federal?
It's, I was
Thanks,
gonna say it's federal money,
Alright.
isn't it?
Yeah, that's great.
Okay.
That's exciting. Thank you.
Okay.
Okay.
Finances next.
Sure. As KT alluded to, the human services, had this format for quite some time. Beata created this with everything looping together. At this time, the year-end projected, we're looking at $1,306,414 that would be to the positive for our department if all things go well. I do want to let you know, we have had some situations that, may impact this a little bit. We have an individual that was part of family care, and they ended up going to the IMD, the Institute for Mental Disease, and they're having a hard time finding a placement. And so when they're in family care and they go to the IMD, that goes back to the county to pay for it. And so they have been there for several months now, and we're not sure if this individual will even get out before the end of the year or longer, and that, there's a significant cost to us for that. So that will, increase our costs somewhat with that. So that's the one caveat there that, we can continue to monitor with that. But otherwise, we're sitting in a really good place. That's an exciting piece too. So.
Good management. Thank you. Any questions on finances? Okay. All right, moving on. Item 11, DHS vouchers paid for August. That amount this month is $285,197.92. I'll need a motion to note review. Ms. Barker, is there a second?
I'll second.
Mr. Lamb, any discussion, questions on the vouchers? If not, all in favor, say aye.
I
Any opposed? The vouchers are noted. Item B is review and action on a request for proposal for a walk-in cooler for stepping stones. As you know, we are essentially passing through grant funds to stepping stones. And I will turn this over to Paula to explain what our role in this process of getting them a new cooler is.
Sure. So Stepping Stones is actually the contractor with the company that completed the RFP, which is ROM Construction. And so the document that you see in your packet here with the service contract is Stepping Stones with ROM. According to CBDG rules, we have to review that contract and ensure that everything that needs to be in there is in there. And I did do that. I walked through all of the documentation that lists that. I ensured it was in this contract. So that's your role tonight, is to say, yep, we're okay with this contract. And then Stepping Stones can go ahead and contract with ROM. So it doesn't, I don't know if we need a motion. Maybe we do.
I
need
think
a
we, do.
motion.
Yes,
probably should have a
I think we
motion on
do,
it.
but I did check because there's not any place in that contract for the Human Services, Health and Human Services Board to sign or approve. We just need a motion to indicate that we trust that the elements.
I'm trying.
Try it,
All right.
try it.
I'll move that we should adopt the contract, and I can say that I have firsthand knowledge of that particular contract, because I looked at maybe our company submitting a proposal on that, and we decided not to. But I read it as part of evaluating whether we wanted to do that or not, so we're good to go. It's all
All right.
there.
All right, the motion is we're good to go. That we recognize that the required elements are present in the contract. You seconded.
Yeah.
All right, any discussion? If not, all in favor, say aye.
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 Any opposed? All right, thank you, approved. And then we have two budget adjustments that, again, our budget adjustments are pretty routine. And the first one is from Public Health. There is a background information and explanation in the budget adjustment. KT, is there anything that you wish to add?
Yeah, I think that it's important that you guys know that there's a couple things at play here. One is, like I had shared earlier, we are doing some cleanup from the previous budget year. So for example, there was one grant for 10 grand that was actually double counted in our budget. And so that is being removed. But then another big thing for you to have some awareness on is that there was a significant cut to our Title 10 and it's called GPR, but it's basically Title 5 Women and Family Health, Reproductive Health grant dollars from the state. And so there was a scramble to find other dollars that could keep us whole for this year. And this grant runs on a kind of a cattywampus year. It actually goes through March of 2023. So this is showing that we are whole for this grant cycle, but that there was an overall reduction in funds for the more consistent funding, which is Title 5 and Title 10, so that there is some makeup funds in there as well. So that's really important for you to know. And then the other story that I'd like you guys to see is that we are scurrying for local dollars and applying for local grants to help support specifically Health Done Right and some of our outreach activities. And so the Community Foundation of Dunn County awarded us $1,000 to support bike helmets and emergency car seats and things like that, so that we can continue to do those things out in the community. So those are the three stories that I want you guys to take away from that very large budget adjustment.
Dr. Hall?
KT, are you anticipating that the next year will also see significantly reduced Title 10 and 5 funds? And so this will be an ongoing issue for us during a time when women's and reproductive health services are really important?
That is a significant concern for us.
All right. I'll need a motion to approve the public health budget adjustment. Supervisor Hagan moves. Is there a second? Ms. Barker seconds. Fighting it out. Fighting it out. Any further discussion on the budget adjustment or any questions? If not, all in favor, say aye.
Aye.
Any opposed? All right, public health budget adjustment is approved, and a budget adjustment for human services. Again, these are generally pretty routine. There is explanation in the budget document. Is there anything you want to add?
Just
Ms.
that this
Winter?
means substance abuse block grant and mental health block grant. That's the acronyms there, and they're just supplemental money that we receive for ARPA.
Okay. Again, I will need a motion to approve. Dr. Hall moves. Ms. Barker seconds. Any further discussion or questions of Ms. Winter? If not, all in favor, say aye.
Aye.
Aye. Any opposed? All right. That looks like we are adjourned unless there are announcements or questions or anything that anybody wishes to add for the good of the order. If not, we're adjourned. Thank you. Thanks, everybody. And thanks for paying such close attention